We're gonna move on to old business, and I've had a request to change the order slightly, and I would like to take item B, the farmer's mill, which, if you recall, goes back to our October meeting, first.
So yeah, as you're aware, we declared a public health nuisance at the mill on October 28th. Got us into the mill early. Got the bankruptcy attorney to sign off, allow us total access. I got the keys to the mill. Anybody wants to take a tour, I'd be glad to take them through there. But in any event, and also Erie County Rat Control Program was gracious enough to come down and tour the facility with us. At the time, it was a fairly warm day, and we were in the facility, and we caught quite a few glimpses of rats, particularly in the basement area where their water supply is. The mill is basically 5 levels for the basement and 4 levels above grounds, and you just loaded with all kinds of food, all kinds of oats and corn and what have you, cornmeal. It's just a rat's paradise, basically. And then compounding things, there's pallets full of specialized horse feed, you name it, it's in the mill. So we got a contractor, we've got an agreement with our county pest controller, Comfort Pest Control, and we went in and did an assessment of the building and made several strategy decisions. So it's a multifaceted approach here where we sealed off the building as much as we could to keep out non-targeted species like, for example, cats and possums and what have you that would try to sneak in there. And we laid down, there's 250 rat traps in the building, for example. A myriad of rodenticides, including liquid tox, tracking powder, your basic, rodenticides are employed. We closed the building up for a week and I called it Rat D-Day on the 13th. We went in and placed all these things. Wow. And then yesterday we went back in and kind of assessed what was going on and ended up with 20 dead rats so far. 12 in traps and 8 apparently were succumbed to some sort of poison. They're just laying there dead. I'm not seeing a lot of rats, and I don't know if it's the cold weather. It's kind of driven them into their burrows. Maybe they're snug or whatever, but they're more shy now. So I'm not catching glimpses of large numbers of rats when I go in there. Having said that, I did have a discussion with the secretary of Farmers Mill, and he indicated that he had been baiting, along through the summer, and that may have taken a couple rounds out of the rat population there. So I really don't know exactly where we're at with the rat population. I mean, it's hard to say.
The exterminator also felt that because we've been in there so much that maybe they were burrowed in a little bit more because it's like they used to all the new stuff.
Right, yeah, they're very suspicious animals, very smart animals, and they're probably suspicious of the rat traps and the bait stations and what have you. Yeah, the other strategy is working with the village, and we're going to start to remove the food source.
Some of the food.
Yeah, we're going to start with all the bag stuff first. Then we're going to start at the top of the mill and kind of just force them down to the basement, and then eventually, take that out too. I see no evidence with the snow cover. I see no evidence of the rats migrating anyplace. I saw some possum tracks and some raccoon tracks, but no rat tracks outside. They're pretty unmistakable. They drag their tail through the snow. Didn't see any of that, so they're not migrating anywhere currently.
Is the feed loose on the floor?
It's horrible. It's horrible. I'll email them. I'll put together an email with some pictures, and I'll blast it out to you. But yeah, there's feed everywhere. It's ridiculous how much food there is in the building.
And what's the plan with the food? It's going to...
Well, actually, the village seems to think we can get rid of it at the sewage treatment plant.
Treatment?
Yeah. Dump it into that to kind of boost the, that's what they're saying.
It'll actually help feed the bacteria.
Yeah, feed the bacteria. Yeah, well, Natalie used to work at one of those plants, so yeah. We're gonna, so they even said they take their dead rats, so.
Oh, that's handy.
What, do you want some, Dr.? Send some your
I
way.
can get you one to stuff if you'd like.
I was just wondering, that sounds like it's a fair amount of feed.
Oh, it's a tremendous amount.
Tons of it.
I would say tons, and not to mention there's silos with there's probably 2 or 3 feet of corn and then one silo, and then there's a big pile of rotting grain out back too that needs to be addressed. It's pretty ugly.
Can you recoup some of the costs of all of this?
Well, we're gonna try with Lynn's help to attach a lien against the bankruptcy, however that
If
plays
it's
out.
for many, you could make bourbon or something.
Well, get the oats to the horses in the cow.
Unfortunately, it's contaminated with rat feces and rat urine, and it's unusable.
That's no
Isn't
good.
that poison?
Yeah.
There'll be a market for that.
We might be able to feed vultures or something, or turkeys maybe, I don't know. So, anyways, any questions about our efforts with the mill? It's gonna take some time.
I think it's good that you got on it really quickly though, so.
Yeah, good job.
Well, with the help of all you other folks, yeah, it was, and the boss, yeah, we hopefully, and I personally don't think it's, I think there's a lot of rats there, but I don't think it's a huge number, to be honest with you. So time will tell, and maybe some of these things have died in their burrows too. So we'll discover them when we start taking out some of this product.
What is the life cycle, like,
6 to 8 weeks, they'll turn over a life cycle. Pretty
females will
quick.
produce how many per litter?
Geez, it's quite a few.
Yeah,
It's
they're
ugly.
very prolific, not
Yeah.
quite, like,
Especially with all that food there, and the
Right.
weather was warm.
Yeah.
And
One day,
Possibly better than rabbits.
And I noticed we caught a lot of immature rats in the trash, so they're probably the younger, not so experienced ones are getting caught at this time. So
Yeah.
Enough about that.
The rats
Not so
smoking
savvy.
cigarettes, yeah.
maybe that's the answer. We'll give them some tobacco over there. So
Little signs out, this is good for you to eat, it's poison.
Thank you, Mark.
You're welcome.
Health department warning comes in.
Anyways, I'll send some good pictures to Sherry, and she can shoot them out to you guys if you're interested. If you don't want to look at them, just delete that email. So,
Thanks,
thank
Mark.
you. You're
Thank
welcome.
you.
Thanks, Mark.
We'll go back to item A, under old business, lead screening levels.
That's me. I get to be the bearer of bad news this evening. I took a look at 3 years worth of data, and I will admit 2019 is not over yet. So our numbers may get better in 2019, but we're still looking at our 1-year-old testing rate is about 55.6% of kids being tested, and our 2-year-old testing rate is slightly better. It's about 58% of kids getting tested.
2-year-old?
Mhm.
You're gonna be worse.
Typically, it has been worse, but that testing rate did get a little bit better. If you look at it by practice, the interesting thing that I see, just kind of anecdotally, I didn't do any statistics, but it looks like the good practices are actually getting a little bit better, and our worst practices are getting a little bit worse. Definitely a trend where we see pediatric practices are doing better than the general practitioners are overall.
What do you see the barrier in your review of this? Because I'd like to look at as a practice. What's the differences in practice where the rates are lower? What are the barriers by talking with them?
One of the huge barriers we see is that practices don't either take the time or don't have the licensing in place to use an on-site machine to test. If the practice is simply or they're not doing the venous pulse themselves. If they're simply handing the patient a script to go to a lab
No, you
for a
get a
test,
30%.
it doesn't happen.
Standard 30%
Yeah.
drop off. You just, no matter
Yeah.
how old the person is, whether they're 60 or 6
Or
months.
6, yeah.
You hand them that thing, 30% will get it done. And then you're chasing them, and it just doesn't work.
And I'm
Should we
guessing
be
that is
buying
why
instruments?
we have bought instruments and placed them in the county, and it has improved testing rates some, but even some of the places that we have instruments still don't do that great. They don't use them.
There are several issues when we looked at the data. One issue is the lack of education, not knowing that this stuff is CLIA waived. CLIA
Right.
waived certification is about $180 for the year. It's not that expensive. I think one of the major barriers is training the staff that's doing the blood draw. So I don't know if there's any funding available or any grants that these practice staff could be trained and comfortable in drawing blood, because that's where the barrier is.
Sure.
And we see it, people like, oh, I have to draw blood on a 9-month-old.
Yeah.
So even if they're motivated, they have the CLIA wave license, they have the instrument, whether they purchased it or it was supplied by the county, it's the training to draw blood. And
That's something we can certainly
that's
look
where
into.
I see the barrier. So maybe a county-wide, a one-day in-service, inviting the practices who are seeing children and inviting their staff and say, hey, we're going to do an in-service. There are several phlebotomists in the area who used to work at the hospital. One of them, Debbie Triscari, we brought her over years ago and had trained our staff. Other practices in the area too. Or invite the staff from the practices who do a lot of this, and they could be
Kind of a mentor.
kind of a mentor in training these folks how simple it is. You just have to have enough practice. So just a food for thought.
Have you correlated the lead rate with immunization rate? Because some of this is also a compliance issue. The ones that you don't get also don't come for immunizations, or they're late on their immunizations.
Absolutely.
I mean, there's it's not only that people are either afraid to draw the blood or don't do it, but also you get the lack of compliance.
Mhm.
And then you're chasing after these individuals trying to get them in for a lead or to go get a venous lead done.
Well, and that's one of the driving factors we think here is this population we're trying to reach is really the population that is moving constantly. So for anybody to try to find them, to do the test or to see them routinely even
And
is,
if you don't catch them the day you have them there,
you're not going to.
Forget it.
Are there any regulations by daycare, preschool, kindergarten that you have to show lead levels?
Oh, that's do you want me to jump
Yeah,
in
go
with
right
this?
ahead.
So Natalie and I have been working collaboratively on this along with some of our other staff, and I just want to update you on some of the things that we have done, and I'll get to that issue. So I attended a couple months ago Cattaraugus County's Lead Smart Partnership meeting, and the takeaway there, their rates are they're right around the same as ours. However, they also have an excellent partnership with their Early Head Start program and also with their WIC program. And both of those entities really do a lot of education with the parents, and actually their Early Head Start insists on lead tests. And if they don't have them, Cat County Health Department goes over and does the finger stick screening. So that's something that we need to talk about with our providers, our early childhood educators. We also talked with the Jamestown Public Schools Board of Education a couple months ago, and they've initiated a task force to start working on the issue of making sure that they're capturing all of the lead tests and results as children are coming into the school system. They're also doing some work on advocacy and addressing that from some other angles. And I'm talking about statewide advocacy. They'd like to make an ask of the New York State Association of School Boards to address this more globally. We had a meeting with Your Care Healthcare Plan, and I think their plan and a couple of others are under a process improvement, or I don't know what the quality improvement initiatives to raise testing rates and practices. So they're interested in working more closely with the practices, and we may be able to talk with them and also at the Western New York Lead Resource Center about your idea of doing some of that training. They would be probably good partners for something like that.
The interesting part of it is, and Bob probably knows, the incentives attached with the lead testing have been around for some time. So I don't think that the dollars and cents are going to still, even if they try to work and say, here's the incentive, whether it's Your Care, Fidelis, it's come down to the will of the people that are on the ground.
Yes.
And if they're not comfortable, we see it with our new staff that we hire. They have to be constantly coaxed by the folks that are doing it. Eventually they get comfortable. I think it's a matter of training the boots on the ground
Mhm.
and developing a
Well,
second
and I
nature.
think they may have the resources to do that because they want to see their numbers as
Good.
from the provider, from the health insurance provider
Perspective,
standpoint.
That'll be great.
Increase. So I think that should be. And then finally, before I get to the other issue, we have started doing a little more public outreach campaign. I don't know if you've seen the billboards. I haven't seen them yet. I heard that they're up. Have you seen them?
I've seen them on
Okay.
CCA.
So very simple, test that there's a lot of lead paint. I think it says 8 out of 10 homes in this county may contain lead paint. Test your lead paint poisons kids. Test your homes, test your kids. We have our number on there, but regardless, I think that message is, we're trying to find something simple for people to hold on to. To the point about the schools and the Office of Family and Children's Services and the Education Department require, or require, like it's on the form, they say, ask for the lead testing results. The problem is the way those are written, it doesn't, it's a very kind of fuzzy follow-up. It says if the child comes in without lead testing results, then they have to advise or educate the family on the importance and refer them to their pediatrician. No place does it say you have to actually come back with results in hand, before we go any further. So that's kind of a
The regulation
sticky
is there,
point.
it's the enforcement.
Yes. Yeah. And I think because the way it's written, it's open to interpretation, and they chose to interpret it in the way that.
Right, but it's also, compliance. I mean, we went so far as to hand out Walmart gift cards, okay? For colonoscopy, mammography, and lead testing, and you still can't get it done. I mean, it's just, there are people who just have other.
Maybe they wanted a different gift card.
Well, I don't know. But the issue is
You did
also
offer to drive that.
some of the areas you're targeting, the day-to-day existence is just so complex. And we think it's just, hey, it's your kid, you're gonna bring, do we have enough heat on the table? Is there abuse? Is there, I mean, it's a very complicated issue.
And a huge number of these moms were lead poisoned themselves.
It's,
So do they even have the mental capacity to understand?
Well, but it's just a very, very difficult issue. It's very funny. I've taken to walking into exam rooms with a Ziploc bag with people who refuse to have a colonoscopy and say, here, you want to wear this on your side? And then suddenly you get people just, it's just one more thing to do, one more,
Excuse my ignorance on this, but does it have to be a venous draw?
No.
You can do
Finger prick.
finger prick?
With the machine in your office.
Right, so I mean that,
Well,
I can't,
the screaming, writhing kid, I mean, it's...
It's a little challenging. People get, and the skin thickness, how deep you put the lancet in. I've had scenarios, most of us, where you walk in, the nurse has stains on the shirt, the exam room has stains.
I will say to that point, we did a training here on our own lead care tube kit to bring one of our nurses up to speed, and also to train me, so I successfully was able to do it. I want to say it's that simple, but when she was trying to get to do mine, whatever, low blood pressure, whatever you want to call it, my finger was bruised and hurt the next day from pinching it and trying to manipulate it. I thought, my God, trying to do this with a 1-year-old or
But
something.
1 and 2-year-old are the thin skin.
But it can be done, and it's done. It's not any different than parents complaining, oh, it's gonna get 3 shots today.
Yeah.
Yeah.
Yeah, but not going to the hospital for multiple weeks and not gonna have a life change.
And I do think another interesting thing in all of the fun staff's had around the office, that I don't think we've really thought a lot about. Tell the story about the break room.
So we knew when we got these lead testing swabs, and I was testing one to make sure that I understood the process of following the directions, and the vinyl, it said vinyl can have lead, and I went and did a chair, it's a, I don't know, probably 70s era chair, it really had to rub, but it was positive for lead. Took them into our, no, well, wait a minute, took them into our break, took another swab into the break room, because I knew those were old chairs. barely touch the thing and it just shoots bright red. So we had, when Bonnie, when I did the test on her, I said, Bonnie, go in and just kind of rub your hands on there and see if we can contaminate the sample. How hard would that, how hard would it take to contaminate? So she went and rubbed her hands on the vinyl a little bit, and her reading was 55. And that's sample contamination. It was not her blood level. But, but like clearly pointing to, there are other sources that vinyl may be an issue.
Well, it made me think, we talk a lot about doors and windows and all of that, but there are a lot of people who go to, church giveaways or helping hands or thrift stores or wherever, and are getting a lot of old furniture that probably they're unknowingly bringing lead into their homes. And I really hadn't thought about that until Lisa told the story about our own chairs that are right down the hall here.
And we did a training and provided community helping hand staff with lead swabs so that if they have product coming in that they're concerned about, that they can test. And we could probably do that with some of the other outlets as well. So.
Do we actually know what Dr. Burke said is true? I just challenge
Everything Dr. Burke says is true.
Well, what?
I just don't want to assume that it's all poor people.
No.
No,
I never said they were poor. I just said it's just lack of compliance because they've
Okay.
got other things going on in their
Some of us are
life.
supposed to give
You don't have to be poor to have a very complex life going on.
Yeah, okay.
You could be
all right.
working, a husband out of town, 3 kids in school. You've got all kinds of things going on, and you may be poor as well, which is not unusual in this county. I mean, this county has a depressed economy at best, and but it's tough.
So the other thing I wanted to comment on when it comes to lead, I was with you a few months ago here and told you about how the new lead levels were going to come into effect October 1. They did come into effect. Last year in 2018, total, the environmental health folks investigated 12 homes in the county that had kids that were above the action level for lead. In October of 2019, from the 1st to the 31st, we inspected 11 homes that had kids that were above that new action level of 5. So in 1 month, we did as many inspections as we did the entire previous year.
How did that affect the budget? My recollection is that during budget development process, midsummer, we were going to request additional funding for additional staff. Did that come to pass?
We did request an additional sanitarian, and that was approved in the budget, but then we were told we had to cut 2 positions. After that went through, then we had to cut, from the county executive, we had to cut 2 other positions. So we didn't gain any extra staff. We actually ended up with 1 less FTE than overall as our entire department. I mean, we are very large, so. And that's kind of the management discretion as to, fortunately, we had a retirement and something that we just are trying to shift things around. So we will have an additional sanitarian in environmental health. We'll just have 1 less investigator in child support.
Thank you.
Yeah.
I think what I've observed though from that change is that we can have another sanitarian, but the support that needs to go behind that, from getting the data off of LeadWeb, we're paying a registered nurse to do some of that work, to the scheduling and the tracking and follow-up of these cases, that it's tight. And to the point, in a way, I think shifting some of my time and focus to working on this lead testing issue, and maybe less about just overall awareness of the prevention program, because we're so stressed in the primary prevention program. So we'll work on getting those more kids tested, which will add. I mean, if we get more kids tested, we're going to have more cases as well. But I think that's the place to focus on.
What we have to do.
Can anybody get access to those testing kits for their own personal use in their homes?
To the lead swabs.
Yeah.
Oh,
You can buy those at Home Depot.
You mean like the wipes?
Yeah.
Yeah. They probably sell them at any of the hardware stores.
Yep.
Yeah, of course.
Except now the insurers are buying all the hospitals. They don't want those procedures then.
Okay, anything else on lead that either of you or bring anybody mind to update?
Then